And now to our health edge. We're talking about menopause today. Tired, mood swings, angry, hot flashes. Menopause. Women, if it hasn't happened to you yet, chances are you spend time with someone who is going through it, and it's pretty obvious. So eventually every woman has to go through it, but how she survives it can differ greatly.
A deep breath in the nose and out the mouth a couple of times.
Nina Beucler is all about mind, body, and soul.
Reach up through the crown of your head.
As a yoga instructor and nutrition coach,
it's not really about a diet, but looking at your food as a way of life.
She spends her days trying to help others feel balanced. But after years of coaching, one day, her own body hit the brakes.
The night sweats, the anxiety for sure, some memory issues, definitely a little bit of weight gain.
And her own advice wouldn't even work on herself. Something didn't seem right.
I realized one day I really woke up and I had an epiphany that it didn't matter how good my nutrition was if my hormones were out of whack, that it wasn't really going to make a difference.
Nina was going through menopause.
We also begin to see lipids become higher and more difficult to manage. We see women with significant struggles with their weight. Sleep issues then evolve into major issues with depression and anxiety.
With those symptoms, balanced hormones and health, Dr. Connie Casad says others often follow, like hot flashes, high blood pressure, diabetes, pelvic pain, vaginal dryness, and lower sex drive. Every woman goes through declining hormones, but today, how they get rebalanced to feeling better is where the road splits. Years ago, when women went through menopause, they only had one option, synthetic hormones, what many call a one-size-fits-all approach. But now they have another option. They're called bioidentical hormones, what some say is a more customized approach, and what Europeans have been using for years. Nina chose the bioidentical hormone route, where progesterone, estrogen, and testosterone are custom-made in a compounding pharmacy based on her needs and her blood levels.
I feel alive again.
Dr.
Casad says now that's the only way she treats women suffering the changes.
If a patient had a hot flash, we would hand them a just standardized dose of a medication. As I got older and began to learn from my patients that they were struggling with many of these options, and it was very frustrating not having any other options to give them, I began to search out ways.
Casad says that every woman should not get the same treatment, but because they are custom-made, bioidentical hormones cannot be FDA approved.
I was having hot flashes and I was irritable and uncomfortable all the time.
Julie Hunsicker, same problem as Nina, but she chose the other route, traditional hormone replacement therapy, FDA approved, one size fits all.
It's made a huge difference. I don't have hot flashes anymore. In fact, I'm cold more than I am hot now.
And for Julie, it's working. But in 2003, many women shied away from this course of treatment out of fear.
Everything changed after the Women's Health Initiative, and medications that we previously thought were largely safe with very little side effects, we learned that there are indeed some things that we need to be cognizant of.
Texas OB/GYN Dr. Kevin Brown says, like breast cancer, coronary artery disease, blood clots, and stroke,
the thing that largely came out of that study is choose the patient population carefully and then make sure you use the smallest possible dose for the shortest possible duration.
But if done correctly, Dr. Brown says traditional hormone replacement therapy does work and is safe. But if you choose to do nothing at all, he has this message.
Good for them. I don't think that medication is required.
Two women, same problems, trying to navigate that long road of menopause, each with a different solution they're happy with.